This session is going to be recorded. So welcome and good morning. Welcome to the final day of the New Jersey State Library's Digital Literacy Forum. I'm Michele Stricker, and I'm the Director of Lifelong Learning, and I'm going to be your monitor for today, moderator for today. Today's focus is on telehealth and health, digital literacy. And we have a wonderful lineup of speakers this morning, and I want to thank them for enthusiastically agreeing to be part of today's program. All right, gotta get the next slide up. Yeah, there we go. So I want to also acknowledge the Lifelong Learning team, Andrea, Mimi, and Sharon, for their hard work in coordinating this forum, and to our state librarian, Jennifer Nelson, whose commitment to equity and digital literacy has been really the catalyst for this event. Their presentations on adult education, ESL, workforce development, and youth services have all been recorded, and you can find them on the State Library's YouTube channel, as will this one be posted up there shortly afterwards. Finding a hard time to find my button that moves forward here. Enter, nope. Sorry for, there we go. So today's agenda is fairly simple. There's our welcome, we're here now. There will be our keynote session, and then afterwards there's going to be a panel discussion to last for the most of the time. Now we're going to leave time for Q&A at the end, so please feel free to put your questions in either the chat or the Q&A, and we'll be monitoring them throughout the presentation today, and we'll try to get to as many as possible at the end of the day. So let's get started. The pandemic and its various variants put a spotlight on inequities in our healthcare system, especially among the most vulnerable populations. The disparities are based on age, income, race, digital literacy skills, and limited proficiency, English proficiency. And that's a vast population who unjustly bear the consequences of low health literacy. Before the pandemic, telehealth was a fairly new technology, and not many people were using it. But with the pandemic and its variants, telehealth has become more relevant than ever and is being implemented on a massive scale as communities try to deal with an ever worsening healthcare crisis. There is a role for librarians to play in advancing health equity, and we are the perfect partners to bring this critical need to our communities. And the New Jersey State Library also has a pilot telehealth program with over 150 libraries participating. Our keynote speaker, Dr. Pamela DeGuzman, has been researching innovative models to improve access to care for vulnerable populations. Her research is grounded in her experience as a bedside nurse, where she observed firsthand the disparities from those rural areas experience when trying to access specialized care at large urban healthcare systems. She has developed and evaluated CARING, which stands for Comprehensive Assistance Rural Intervention, Nursing and Guidance. And that is a nurse-led telemedicine delivered intervention aimed at connecting rural cancer victims with specialized oncology care. This experience led her to work towards access to telemedicine visits for patients who lacked home-based broadband through public libraries. Dr. DeGuzman is an associate professor in the Department of Family, Community, and Mental Health Systems at the School of Nursing at the University of Virginia. She has published over 40 peer-reviewed articles, and her research can be found in the Journal of Cancer Survivorship, Public Health Nursing, Clinical Journal of Oncology Nursing, Oncology Nursing Forum, Hospice and Palliative Care, and Nursing and the Public Library Quarterly. Since 2019, she has been studying the implementation of telemedicine video visits in public libraries and has written the foundational research agenda aimed at studying this practice. So welcome, Dr. DeGuzman. I'm going to stop sharing my screen and I'm going to turn it over to you.
Great, thank you. Can you all hear me?
Yes, we can.
Yes.
Great. Okay, I'm going to go ahead and can you see my screen as well?
Yes.
Great. Okay. So, and thank you so much, Michele. I really appreciate that introduction, and I'm just delighted to be here to be able to speak to you about this, which has become a little bit of my life's passion over the last several years, because as Michele mentioned, I'm very motivated to improve access to care for people who, have difficulty, connecting to things that a lot of us just take for granted. Today, I'm just going to start off with a definition of telemedicine and telehealth, just to kind of get everyone on the same page with definitions, talk a little bit about broadband and digital inclusion disparities, particularly focused on rural areas. And then I'm going to cover at a pretty high level, but the research that we've been doing in the last few years, but try to give you information that is really pertinent to your own library practice. And then I'm going to end with some thoughts about, if you're implementing this, things that you need to think about as you plan your own program. So let's start with talking about telemedicine. A lot of people use the terms telemedicine and telehealth pretty interchangeably. In fact, in healthcare, a lot of people do that too. Not everybody even uses the same definitions, but these come from the Department of Health and Human Services and the American Telehealth Association. So these are the ones that I use when I talk about it. And as you can see in the diagram, telehealth is the big circle. It's really any time we're using electronic information or telecommunications technology to support clinical healthcare over a distance. And that could be anything from emailing your provider, or if you go and you get an X-ray or a CAT scan and those films are sent to your provider from another location, that is all considered to be telehealth. And telemedicine is the smaller circle inside, and that definition is typically limited to any time there is an actual direct patient care, synchronous real-time event, such as I talk about video visits. And that's probably the thing that we're most familiar with since the pandemic started, is having that real-time visit with a provider over an audio and video signal. But you may not realize that a phone call can also be considered telemedicine, because if you're getting information from a provider, it is over that long distance care using technology, and is still considered telemedicine and telehealth. But in this presentation, and typically what I talk about when I'm talking about using the library for telemedicine, is more specific to that video visit, and that's what I'll be talking about today. As I mentioned, and I'm sure people here are very familiar with, there are barriers to telemedicine in rural areas. Let me just get my little laser pointer here. So you can see these graphs from the Pew Center, and they have been tracking really for the last 21 years, the percent of adults who say they have home-based broadband. And as you can see, there's a bit of a disparity between rural and other areas. But even in urban and suburban areas, it's not 100%. And in rural areas, there's a definite gap. Although in rural areas, another consideration is, for those of you who live in an urban or suburban area, I live in an urban area, if I don't have home-based broadband, there's somewhere I can walk to within 5 or 10 minutes, and probably I can walk to, McDonald's, a coffee shop, another coffee shop, my library, all within a few minutes. Or in some cases, if you're in a suburban area, you can probably drive to those places pretty quickly where you can get access to broadband. But in rural, not so much, because everything is so spread out. And a lot of places just don't have the broadband infrastructure available. So that makes this gap probably a lot bigger than it appears even on this graph when we're talking about getting access for a telemedicine video visit. And even as you can see on the right, there's a difference in smartphones, people who have smartphones. And those of you who work in a rural area, work with anybody from a rural area, probably know a lot of people in rural do not have a smartphone. They might have a flip phone still, and some of them are just using landlines. And so when we think about the equipment that's needed, in addition to broadband, that may be lacking as well. And as a result, people are not able to connect to broadband as easily in order to do a telemedicine video visit. And as I'm sure you all know, being librarians, and what we discovered early on when we started doing research with telemedicine prior to the pandemic, is that digital inclusion is also a pretty big issue. And that really, what we refer to here means that even if you're providing the broadband, even if you're providing the equipment, that in particular in rural areas, we know that a lot of people lack the skills and the digital literacy to use telemedicine. And in fact, we saw that in a study that really launched for me this whole program of research. We did, as Michele mentioned, a telemedicine video visit with rural cancer survivors. And you can see in this picture here, which was taken by our local TV station. This is Alan. He was our study nurse, our oncology nurse who delivered the intervention. And actually this person on the other end is actually another member of our study team, but this just demonstrates him delivering the intervention to rural survivors from our cancer center. And what I find so funny about this now is that the TV station came out and interviewed us and did a story about this, because in 2019, this was still considered really novel. Of course, now a lot of places are doing telemedicine and have specific interventions to do this, so it probably wouldn't make as much of a news story today. But what we found was that we had a lot of people that didn't have broadband at home, and we would send them a digitally enabled tablet, an iPad, that they didn't have to pay for connectivity, and it could be connected to the cellular signal. But even then, people who are not used to using that equipment struggled mightily with trying to connect. And in the end, we found that for those individuals, we were actually causing more distress, which we didn't want to do. This intervention was all about reducing their distress. And so we realized we needed another option. And I have this great quote here from one of our head and neck cancer survivors who was trying so hard to connect. She really wanted to talk to Alan and eventually was able to, but she said, it was just not connecting. And that's just nerve-wracking when something doesn't work and you're trying, and this woman just really wanted to be able to speak with him. She lived 2.5 hours from the cancer center, and she could only get there in a Medicaid cab, which was hard to get available. So this was such a great intervention for her, but she just really struggled to connect. And that, of course, has led us to here, which is looking at telemedicine in public libraries. And as Michele mentioned, and I'm sure you all know, it really is a perfect fit. What you may not realize is there has been an urgency around making telemedicine more accessible for rural populations that predates COVID. There had been a lot written about it from public health professionals in the industry. And you would think it's kind of ironic because telemedicine helps you, deliver care over a distance. And yet the very people we need to be able to help, we were struggling with doing that. Libraries, of course, are an ideal solution. First of all, as I'm sure you all know, they generally have the technology, they have equipment, they have high-speed internet. But more importantly, what we wanted was that this second thing, they have information access expertise. The person that can say, hey, you just have to push this button to connect, or, oh, here's how to get into your email to find the Zoom link to connect to your provider, because those are the things people were struggling with. And then the other thing that we know is that libraries are available nationwide and accessible to rural and remote areas when other places, and healthcare providers may not be. In fact, we did a study and we looked in Virginia in particular, and we found that virtually the entire population lived within a 30-minute drive of a public library. That may not be the case in some of the larger states, but I would imagine in a state like New Jersey, that probably is the case as well. So now I'm going to talk a bit about our research, and I've, like the rest of the world, everything is divided into pre-COVID and since COVID. And I'm going to start with just some stuff we did pre-COVID as we were launching into this. And at that point, we found no research had been conducted at all looking at telemedicine in public libraries. And so I'll talk briefly about a study we did on technology readiness of libraries. And then since COVID, we've done a number of studies. Two, I think, have been published. We have a research agenda that's been published and a paper on librarian perspectives. And then I'm going to talk about two new studies that we're in the process of publishing right now, but I'm going to share those findings with you as well. So let's start with pre-COVID. So the first thing we did when we realized we wanted to investigate the idea of doing telemedicine in public libraries was we wanted to see what equipment and what space places had, because we knew a little bit about Wi-Fi, we knew a little bit about equipment from, there's an IMLS survey that's nationwide, but we didn't know things about private space. And of course, that's really critical when you're looking at telemedicine. So we conducted this survey in Virginia. The Virginia Library Association helped us by sending the survey out to their members. And you can see on this map, I've just put a little pin where we had all our respondents, and I color coded the map so that you can see rural versus urban. And the green areas and the yellow are the more rural areas, with the dark green is the most rural. And then the pink and this sort of purplish pink and the orange are the more urban areas, with this light pink being the most urban. And so you can see we got a pretty good swath across rural and urban. And we have a couple of findings, and I put the citation for these when I have them, so that if you're interested in going back later and looking at these papers, they are available. But we found that 85% of the libraries we surveyed had equipment and had a private space needed for a telemedicine visit. And so that we thought was very encouraging at the time, because we weren't sure what we would find, particularly around space. But importantly, there were no differences between rural and urban libraries. Now, you might see on this kind of back corner, this is Southwest Virginia, which is the most rural area of the state. We didn't actually get any respondents from there, and it's possible if we did, we would have found more differences between rural and urban. But of the people we surveyed, that there were no differences between rural and urban libraries. So after this, when we got this published, COVID had already started, and we did begin to hear about that kind of trickle of one or two programs that were beginning to start this practice. But again, it was really a trickle of places that were doing telemedicine in the library. And so that really guided the next phase of our research. And as I mentioned earlier, there wasn't any research, and I felt like this was something that really needed to be studied in order to make it happen more throughout the country and support the implementation of this. And so we launched a paper that was an implementation research agenda. So let me just explain a little bit about what that is. The research agenda is basically just setting forth all the questions that we thought could or should be answered that would help guide this practice. And so we weren't answering the questions here, we were just sort of posing the questions we thought would be interesting to the field. And the implementation piece of it, when we do implementation research, that's when we know something works. We know telemedicine is effective for, reducing people's distance to care, and we know that the libraries are a place that it could happen, but it's not being done that much. And we want to study the process of people implementing it as they do, to discover what barriers are they encountering, or what did they find that was surprising, all those kinds of things. So that's the implementation piece of it. And we used a health implementation framework called REAIM, and I'll explain this a little bit more in a minute, but that stands for Reach, Efficacy, Adoption, Implementation, and Maintenance. So we used this framework, and we came up with several questions that we posed in this paper. Now, the first two parts of REAIM, the Reach and the efficacy are all about asking questions about how is this practice impacting patients, because this is a health framework. So for REACH, we would want to know how many patients are participating in telemedicine in public libraries. And we want to know who's participating, because a lot of these programs, and certainly the program that I was envisioning, was something that was really for more vulnerable populations. And so I kind of, thought we should know what categories of people are coming in. Is it more vulnerable patients, or is it just sort of like white middle class people that find the library more convenient? And as of right now, we don't have enough information to be able to answer those questions. But those are questions that definitely need to be answered going forward. The same with efficacy. Efficacy is all about patients and how it actually impacts their health. So we want to ask, well, what are their health outcomes? Are they healthier? Maybe they have fewer missed appointments if they can do telemedicine from a library, or maybe they're traveling less distance, using less gas, and that might be really important for people with low socioeconomic status. So again, we really don't have any information to answer that yet. The last three, the A, I, and M, are all about studying the settings themselves, the libraries. And this is an area where we are starting to answer some of these questions. But the questions we asked were around adoption. We wanted to know what libraries are adopting this program and what are the characteristics of those libraries. For me, I wanted to know, is it more rural or urban, or large libraries or small libraries? And then we wanted to know about implementation, and that's looking at the different libraries and saying, is it implemented the same way everywhere? What differences are we seeing? What's driving those differences? And then finally, maintenance. Once these programs are up and running, are they sustainable? Because that's going to be important to people who are considering adopting this. Is this even a sustainable program? Are there funding needs ongoing? And understanding that. And so we're beginning to really answer these three questions, and I will talk about those answers here in a minute. So let's see, there we go. So we began to launch this program of research, and the first one we did was a study where we recruited through the Association of Rural and Small Libraries, because again, I was really focused on looking at rural libraries and rural librarians, and I wanted to understand their perspectives on what were the benefits of this that they saw, what were the barriers, and trying to understand why implementation had been so low. And of the 15 librarians and library directors that we spoke to in late 2020, all of them had not implemented this. Some had considered it, and one of them actually was implementing it at the time. And here's just an image of where the 15 librarians came from. We did try to get a pretty national swath, focused a bit in the Northeast, but we had people as far west as Washington and interviewees as far south as Texas. And I'm going to provide just a little overview of our findings. The two major findings, the first one was we did find that these librarians were highly supportive of telemedicine in the library, but understandably, they had some concerns. And one of the biggest concerns that we saw was around their legal vulnerability, because everyone's heard of HIPAA and no one at the time really understood how it impacted libraries at all. Of course, HIPAA, we know applies to the providers of care, not necessarily the space, unless the space is somehow involved in the delivery of care. But still, that information needed to get out there, and then librarians need to understand, were there any other liability issues that they needed to worry about. The second thing was the logistics. Librarians we spoke to didn't understand how scheduling would work, or one of them worried that, would they have to be involved in it with insurance companies? There were no models yet really for how this would work. And then finally, remember, this was at the end of 2020, so a lot of people were worried about sick patients coming in. In fact, I have this great quote over here from a librarian that said, people will come in and they'll say, my left arm hurts. And I think, boom, they drop dead with a heart attack. And you're like, okay, we're not doctors now. What do we do? And so I think there was just this worry about, patients coming in that were acutely ill or maybe infectious. The second major finding was, again, not going to be surprising, I'm sure, to the people on this call, which was that really what was driving this limitation and implementation was limited resources. And in these rural libraries in particular, that was very acute limitations in space and money. These are very small spaces. I believe the average rural library, small rural library, is around 2,500 square feet. So not a very big footprint, and not every place has like a extra closet or even a private room that they could use. But money was an issue as well. And I had this one librarian that explained, we are not state aided or even have any dedicated funding source through tax revenues. And they explained, my biggest challenge is making sure that we have enough money to keep going. And this was someone who did an annual fundraiser to fund their library. And with COVID, they weren't able to do that. They were extremely worried. So completely understandable why they would not be open to implementing telemedicine. Now I'm going to shift gears and talk about another study that we have not published yet, but I'm going to share some findings with you. And this is a study where we went to healthcare providers and to get their perspectives. And this is really important because, as you've probably learned through other sources, or I'll talk about here in a little bit, we are really starting to learn that the most successful programs are those where there is a collaboration with a healthcare provider. And so we wanted to find out, well, how do healthcare providers feel about this? What are their perspectives? What are their concerns? And we did a survey over the internet with 50 physicians and nurse practitioners. And then we followed that up with interviews of 12 of them, which ended up only being nurse practitioners. None of the physicians participated in the interviews, but I have that information in here as well. So the first thing that we wanted to know, just right off the bat, is would you be open to your patients using telehealth services from a local library for their consultations with you? And overwhelmingly, as you can see, the answer was yes. 82% said yes, and the other less than 20% either said, a few said no, and some said maybe they weren't quite sure about it. This was really encouraging to us that it was such an overwhelmingly positive response. And one of the nurse practitioners explained this really great example of why they were supportive. They said, I've been on telemedicine visits as a provider before, where there's 5 kids bouncing around in the background and I'm trying to teach them, meaning the parents, things. There's no way they're going to hear that. You might be better even just to put your other 2 kids in a reading circle. So this person was thinking, the library is a great place for kids, and then the parent could have a private conversation without all the kids in the background. The next thing we wanted to know was what services could be delivered to patients using telehealth at a library, because as we've seen, librarians are not going to be super supportive of acute care visits or infectious visits. And so we wanted to see, well, what are providers' perspective? And over 92% of the physicians that we surveyed thought health promotion visits would work well, health education visits would work out well, and really importantly, chronic illness management. This was important to me because you'll remember my background was in cancer survivorship, which is essentially a chronic illness. And I knew that our patients didn't have to go see the provider every time, but they did need that support from an oncology nurse or an oncology provider in the interim. And so I was really delighted to see that there was so much support for this. And one of the nurse practitioners said they could think of a way this could be so useful if I could fax something or email something to be printed off at the library. And they were referring to like around education. That might be good because we do give a lot for certain kids, a lot of educational material. And so again, you could really see the support for health education in particular. We also asked them about their top concerns, and probably not surprisingly, 2/3 of them were concerned about patient privacy and security. What I really loved about this answer is every telemedicine in a library program I've talked to or worked with, this has been their top concern as well. And so I think that a big part of the work we have to do when collaborating with healthcare providers is to educate them about this is what we're doing, this is what we're providing. We are not just putting somebody in the main room with a desktop computer and having them do a telemedicine visit. The other thing that I thought was interesting was that the second most common concern was that the patients were unfamiliar with technology. Again, we need to be educating our providers. The library is the place to get help with technology, but a lot of people still envision the library sort of the kind of old-fashioned way as the place you go to get books. So this is an education issue we need to do with our healthcare providers. And here's another quote from a nurse practitioner said, you might see some hesitation from patients unless there's an established channel. It would need to be a space that for HIPAA regulations could be pretty confined. And again, while libraries might not be required under HIPAA to provide this privacy and safety, if we're going to convince providers that this is a safe place for their patients, then this work needs to be done. The good news is it's being done. And then finally, what I wanted to share from this study, because this comes up sometimes in conversations, is people want to know, are the providers concerned about malpractice or liability? And only a quarter of them answered that they were. So again, I thought this was very encouraging. That's overwhelmingly, this did not really seem to be a concern of most people. However, it is something you might encounter because about 25% of people had some concerns with it. So what did we learn from that? Again, as we establish these partnerships with providers, as librarians, I think the real work that needs to be done is to collaborate with providers and educate them about that the library has the connectivity, that they have the privacy and the confidentiality, and the technology support is available in these programs and just in the library in general. And I always refer to this quote from one of my favorite librarians who has implemented this. This person said, "We're always fighting nostalgia." Again, just the idea that the library is where you go to get books like it was when you were little. Well, we all know it's not that anymore. It's more you're going to connect to technology, to connect to information that's available most often digitally. Now, I'm going to just review one more study that we've just done this analysis. So this is only, I think, the second group to hear this, this talk. This is all brand new information. We have not published it yet. We did a study of what we call early adopters, the first groups that we could find, the first libraries and library systems that we could find around the country that were implementing telemedicine, and did sort of like a multi-case study of them. And I'm going to share some findings with you. The first thing you can see is I have anonymized them, although the people that participated in this study know that you could probably, if you're familiar with this at all, you could probably kind of figure out who they are, which is okay, but we present it as anonymous, which is why I've got these big giant stars instead of a specific location for each one. But as you can see, they are far reaching around the country, with the exception of sort of this mountain area and the West Coast, although we know since then a lot of programs have popped up in those areas as well. So on here, again, I have the 5 programs and I've color coded them because remember, I'm very interested in questions about rurality. And so the green ones are those that are serving rural populations, whereas this last one, the one early adopter we found one early adopter that was serving an urban population. And what was interesting about this one was they were doing a very specific implementation. At the beginning of the pandemic, when everything kind of closed and all the providers closed, everything went to telemedicine, of course, which is what spurred a lot of this. They had a population in their city of people who needed substance abuse counseling, addictions counseling, mental health counseling, but at the same time did not have access to telemedicine. And so this library collaborated with all those providers in their city and to offer these services. And so the program was only for those specific providers, but those people could come in. There was a dedicated room, they had dedicated scheduling for this group of people and this group of providers. The other thing that is interesting about this is that these 4 programs are all still up and running, but this urban one actually shut down at some point because the reason for it had been the providers not being able to offer in-person visits. Once everybody opened their doors up again to offer in-person visits, it really wasn't being utilized anymore, and they ended up closing the program. So it just tells us a little bit about what the needs are, although I could absolutely see in some urban areas where you would still need to have this service for certain people or certain groups. So just a little bit specifics about the programs that I'll share with you. One of the things we looked at with each program was what we call an eligibility model. And that means, how are patients eligible to use the telemedicine equipment and space in the library? So one of them is library access. This means that patients would schedule the use of the telemedicine room and the equipment through the library. And you can see there was one library that had, you would only be able to use it through that, through contacting the library. And then another model was provider access, which means that patients could only schedule use of the library's telemedicine room and equipment through that partnering provider. And you can see number 5 that I talked about was provider access only. Most programs that we studied were what we call hybrid, which is basically it offered both. They had a healthcare partner that could schedule visits for them, but anybody could also come in and say, I'd like to use a telemedicine room in the library. And because of that, when you look at the patient types that they served, if you were library access or hybrid, they could serve any patient, whereas this last one only served patients who had a provider relationship with these docs and providers for mental health, substance use, and addictions. The next thing I'll mention is the privacy structure. Again, I'm sure this is, if you've thought about this at all, or if you've implemented this, is something that you thought about pretty early on. How do we provide privacy for the different, for patients if we're going to offer this? And a lot of them, as you can see, offer a private room. This one actually took a room out of inventory and only made it for this one program, because I think that it was pretty well trafficked program, whereas others just offered the use of a private room. This one, number 2, actually renovated a closet and made it a dedicated space for telemedicine, because it had been a closet prior. They weren't taking a private room out of service. And this one, number 1, in their 3 libraries that they implemented in, did freestanding kiosks, which, as you can imagine, you have to have the space to be able to do that in, and they did, but it also has the benefit of not taking a private room away. And I looked on the internet and I found this, just in case you wanted to know what a kiosk might look like. Here is one that I grabbed from the internet. It's basically just a small room, probably around 6 by 6, and then typically would have like a chair and a desk and a tablet and all the connectivity. And typically they would be soundproof as well. So I'm going to close out. Hopefully I've given you a lot to think about, but I want to close by giving you some thoughts about if you're planning your own program. As you do, what are the kinds of things you need to be thinking about? And the first thing might surprise you, and that is to do your community assessment. Because if you're interested in a certain community that most places and librarians know their communities pretty well, and they know who those vulnerable populations are. So think about that. Are these the people that you're trying to attract to your program or to support? Maybe you have an elderly population. We know that older people have more trouble with technology. Socioeconomic status. If people are on the lower end of the SES continuum, they are less likely to be able to afford home-based broadband or a smartphone. And also, even in an urban area, transportation can become prohibitively expensive, particularly with the price of gas right now. Maybe you have a homeless population you're trying to serve. Maybe you have a population with language barriers or other barriers, or an undocumented immigrant population you're trying to serve. And then think about, who are their care providers? is there one main care provider? Are there a group of care providers, or is it certain issues that this population is having that you want to try to address? And think about partnering with those care providers and consider reaching out to them to see if there's some opportunity for collaboration. But also you want to think, particularly if you're aiming at a community that may be underserved, they're going to be harder to reach. And so what we're seeing, I didn't go over it as much here, but what we're seeing with these early adopters is traditional library marketing tactics may not be effective in bringing these populations in. Of course, you think about it, if you're doing social media, which is very affordable, it may not be reaching people who don't have good internet access. So a way to overcome that may be either, as I mentioned, a healthcare provider, or finding a trusted member of that community and building that relationship with them. In fact, I would assume that a lot of librarians already have those relationships in their communities as well. And then, of course, you want to do your library assessment. You want to consider your board. Are they supportive? If they're not, this may be a no-go. What's the eligibility model you're interested in? Do you want that library access, the provider access, or hybrid? And if you want to do something with the provider, do you have a collaborator in mind? You obviously want to think about your equipment. I know I don't have to explain this to anybody in the room. And you want to consider your private space. Do you have a private space? Are you going to take it out of inventory or make it available at certain times? Or do you have space for a kiosk? And of course, speaking of a kiosk, you have to think about money. One of the things we've definitely seen is you can do these programs with no additional money, but it's harder to drive attendance without at least a little bit of money for a space or renovation. But it does not seem to be like a prohibitively expensive amount of money too, but you may need to purchase something. The other thing is, in an urban area, you probably would need to think about staff if this is something that is overly subscribed, versus in a rural area, there didn't seem to be big considerations for having to add any staff. So with that, I'm going to close out and just thank you so much. I appreciate the opportunity to present this to you, and I look forward to hearing from the rest of the panel and the questions in the chat.
Thank you, Pam. That was great. Very interesting, all those statistics. There's just a few things that I jotted down that I thought were interesting to me. First of all, I was surprised at how many people are still using flip phones. And I think somebody noted that also in in the chat. I mean, I know my mom still uses a flip phone, but she's 97, so I can understand that. But I didn't know actually that so many of them were like still on the market. So that was very interesting to me. And other things we've talked about in the program that we're having in New Jersey is really sort of the legal vulnerability. The librarians are concerned. They're helping give out health information, and yet they don't want to be responsible if someone is ill and needs, diagnoses and things like that. They don't want to be put on the spot and have to give out that kind of information. So there is some kind of concern about that, although that really hasn't stopped them from offering the services. They really have jumped in and wanted to do this anyway, but there sort of was a big discussion about how they're going to balance that and not really be able to do that, because remember, we're giving information. We're not we're not lawyers, or we're not nurses and doctors, and we really don't want to be involved in doing that. So that was very interesting to me. And also the fact that you said that there are so many models out there that really don't cost much to do, and really don't take much more staff time, especially if you're doing like you're loaning out an iPad or something with a few apps on there for people to use. There's just a matter of you buying an iPad or two and then letting it circulate, just people who actually need it. So, and then the last thing I was noticing that you mentioned, we're fighting nostalgia, versus the books versus the connectivity and the tech support. And, I thought we had moved along a little further than that. I thought that we had been working hard to kind of overturn that stereotype. But if you're still finding that, in your studies, maybe that's something that we need to work on even more. So those are just a couple of things that I noticed and thought about during your great presentation. And thank you. So take a breather here for a second, and we're going to move on to our panel discussion. So if I can have Tony and Bob pop on.
Michele, before you introduce them, I just wanted to point you to a question in the Q&A.
Oh, okay, sure. Let's take a look at that. And I see that now. I told you I can't multitask. So would a private space need to be soundproof for telemed? That's for Pam.
So I think this goes back to that sort of legal kind of vulnerability thing. Libraries are not required to have any of this, is my understanding, because they are not providing the care, so they're not under HIPAA. So I talked to a mental health provider just the other day who said, someone called her from a Taco Bell. If the patient is choosing to go there and doing it, my understanding, again, I am not a legal expert, so I'm not giving legal advice, but my understanding from people in the industry is like, it's all on the provider. And if the provider is okay with it and the patient's okay with it, it's totally fine. But the provider is not responsible for where the patient goes. If the provider sees the patient is in, Taco Bell, they're not going to say, don't have the visit. Like they're not responsible for that. It's the patient's responsibility to make that choice. But I think that we need more. So I would say no. I would assume that a lot of these places are doing it without soundproofing. But in order for people to kind of feel comfortable, I think we might move in that direction, first of all, or at least ensure it the best that can be. But also, I think we want to just give, confidence to people that, even if it's not soundproof, like there was one person I talked to at one library for that last study who said they turn on a fan outside the room, like a noise canceling fan or something like that, to make sure the patient's comfortable, like if they want that. I mean, that's another way you could ensure that. So it's kind of a complicated answer. We need more definitive guidance around it. And I've tried to get this lawyer at UVA she's a HIPAA expert, to engage in this. I'm going to try her again this summer to see if she'll write something about it. Because right now there's just nothing out there to give people that confidence.
I have another question for you, actually. You brought up the kiosks, and that's something that I thought a lot about when we were doing our pilot telehealth program. I know Delaware has, I think, 3 of those kiosks. And, the thing is, I didn't want to put too much extra work for the librarians. And so what is the upkeep on those? How hard is it? It just seems to me like, you need the librarians to go in and maybe disinfect everything and reset. I know there's like blood pressure cups and pulse ox, devices in there. And I just thought that might be a little too much for librarians. So I wondered what you thought.
Yeah, I think you're absolutely right that I'll just say I didn't present all the data from this, but there are a range of programs and that's why you can do it from $0 to the one that has the most money has probably raised over $500,000 to support that. Most places aren't going to have that. And so in terms of cleaning, like if it's a room, or I think typically with rooms, they just have a protocol that they if they have a healthcare partnership, the healthcare partner has helped them develop a protocol for cleaning, because you have to like spray stuff on and leave it for 10 minutes or whatever. But just to sort of have that confidence. I think the kiosks, I'm not the expert in the kiosks, but they have a UV light that they just have to kind of push a button and it sanitizes it. Which is, I think, convenient from that standpoint. But then, of course, going, forward, then you have to worry about the upkeep of that. What if the UV light breaks? I mean, I think that's why, you have to think really a lot about what's the money for this now, but also what is your funds flow from it, going forward. And those kiosks aren't going to be right for everybody.
Yeah.
But the Delaware's is a pretty expansive program. I mean, they're just they have wraparound services. They have a whole bunch of stuff that a lot of, smaller libraries probably don't have.
I think they were the pioneers for libraries in this entire telehealth thing. Okay,
So
thank you. I don't think there's any other questions.
Michele,
Yeah.
I actually have a question that's directly related to Pam's presentation, so if you don't mind.
Sure.
So that was a fantastic information that you presented, Pam, so I really appreciate it. Looking at the telemedicine services that are happening in public libraries, and the kiosk and the designated space as a telemedicine room, and all those are really fantastic. So for me, the assumption is that the patients or the patrons do have access to the healthcare already. Is that right? So I think looking at the vulnerable populations that we serve in public libraries, for me, my concern would not be so much about the facility access, but the healthcare access.
Yeah.
So, yeah.
So again, I think it depends on the model, and that's where, like, when you're implementing it, you have to think about who you're trying to partner with. If you want to try to get people that are not in the system, you might partner with more like a free clinic or something like that. I think you can find those people, or like finding that person that's a community, a trusted person in that community that you're trying to reach. Maybe it's the homeless population or something like that. I think there are ways to approach that, but you have to start, I believe you have to start with that intentionality about who you're trying to access. And not all the programs are trying to access people that are not already in the system. But the other thing, I think about Diane's program down in Texas. I mean, she was pretty much open to anybody. She just said, do you need an appointment? We'll get you an appointment at, I think it was North Dallas. I can't remember the name of their health system they worked with. I think that she did have a way to try to get people in the door that otherwise wouldn't have a provider. So I would just say, I really believe it starts with the library and knowing the community and knowing who they want to try to reach. Or to just be open to whomever, which is another way to do it. So does that answer your question?
Yes, thank you.
And Mimi, in our project in New Jersey, we made it very, very simple for low digital literacy people. And so there are some telehealth apps on there with our hospitals, at the hospitals and doctors' use, primarily in New Jersey. But then there's a section for just doing, databases for research like Medline Plus, that is offered in 100 different languages. And then there's services for mental health. So not all of it is, connecting with a doctor through a telehealth visit. So they can use it that way too. So there's a variety of ways to use it.
Excellent. Thank you so much.
You're welcome. Thanks, Pam. So at this time, to encourage a further conversation around digital health, we have 3 experts working in the field who are going to be on our panel this morning. And Pam is staying with us, thankfully, although she, if I didn't mention before, she does have another keynote to do today. So she's very, very popular. And then I would like to introduce Tony Nguyen and Robert Kley. And so I'll give you a little bit about their backgrounds. Tony is the executive director of the Region 1 Network of the National Library of Medicine, NNLM. We were talking about what a mouthful that was before we got on today. And they're located at the Health Sciences and Human Services Library at the University of Baltimore, Maryland, Baltimore. So Tony oversees the planning, implementation, management, and the evaluation of the overall regional medical library program, and oversees the day-to-day operations of the office and identifies regional opportunities to support NLM priorities and the NNLM initiatives. And Robert Kley, Bob Kley, is the vice president and Chief Operating Officer of the Mental Health Association of New Jersey, and we've partnered with them on several projects before. He's worked there since 1986, serving in a variety of capacities before assuming the VP COO role in 2002. Under his innovative leadership, the association led to the creation of a broad array of nationally recognized peer recovery support training programs and the association's statewide call center. He directed the organization's response to Hurricane Sandy through New Jersey Hope and Healing. The shift to virtual support services during COVID resulted in the United for Wellness, a virtual wellness and recovery center. Community partnerships and collaboration are the cornerstone of his philosophy to build a strong social justice foundation to address the racial and cultural inequities and inequalities and stigma that limit access to behavioral health services. So I want to welcome everyone. Thank you for agreeing to be on our panel. And as you know, we do have a list of questions that we're going to be working from, and look forward to hearing your discussion about them. And the first is a question that we have asked every panel on this four-day forum. So for you, what is digital literacy in the context of health literacy and telehealth? And what is health literacy in simple terms? Tony, why don't we start with you? Give Pam a little break.
Oh, but Pam is so eloquent. So I was thinking about the definition of digital health literacy, and it's related to seeking, finding, understanding, and appraising health information from electronic resources. So things that they might find through an app or things they find on a website that they've discovered or someone shared with them. But from there, it's taking all of that information and applying that knowledge and using it to solve a particular health issue that they've are trying to understand and wrap their minds around. That, I think, is the definition of digital health literacy. For me, when I think about the integrating telehealth with the diverse digital literacy skills, there's so much involved, and that includes not just reliable Wi-Fi or broadband access, but making sure that they can connect to the internet, connect to a browser, have access to an email. They're capable of downloading an app. When I was told that I needed to download an app to access my own electronic health record, for instance, to communicate with my doctor, I had so many steps. And I also put things in a perspective of my own mother, who is 85 right now. And so for her to do that, she gave up, right? She just couldn't process how to do all of that stuff. And then I also there's multi-authentication necessary to get into those apps. So setting up the security, she can't remember codes or anything to access these things. It's very difficult for her. And that's what I think about when I think about digital literacy, telehealth, especially during the pandemic. And I also know that equipment goes out of date quite quickly, quite easily. And so apps are trying to keep up to date and make changes. So if I had still back when I had an iPhone 8, for instance, I can't use my electronic health record app anymore. So it's trying to keep up with all of the technology needs and make sure that a camera or microphone or speaker works. So, what I did was I ended up talking to her doctors, because she was dealing with breast cancer back then, and saying, can you just call her instead of trying to do all of this visual discussions and everything like that. So I definitely do that kind of pivoting of thinking about my mom and what she does when she's trying to get healthcare, and the issues she has with trying to access healthcare throughout this whole pandemic.
So you talked about digital health literacy a lot. And what do you see as just general health literacy? Because I think the digital part of it comes under the whole banner of health literacy?
So in thinking about health literacy a little more in general, it's being able to find and understand the health information, evaluate it for, is it current? Is it relevant? Is it applicable for the specific needs? Is it understandable as well? There are many issues related to health literacy, especially, again, with my mom in mind. English is her third language, and finding information in either the other two languages she was raised with is hard when you're trying to apply it to US standards. So dosages, everything is a little different. So, trying to find things in an appropriate language for the user can be a little tricky. I mean, I personally have used Medline Plus for my own family, much to my own chagrin, that because I'm paid by the National Library of Medicine, I'm promoting their website basically anyway. But there are a lot of good things that they've been able to integrate so that I can try and find things in an easy to understand way for someone who is currently having some difficulty reading and needs bifocals now. Well, actually, I need bifocals now myself. So it's a no-win situation at my age now. Hopefully that helps.
Yes, thank you. How about you? What is digital literacy in the context of health literacy? And what is health literacy in simple terms? And of course, you come from a different perspective, which I'm glad.
I'm going to come from a little different perspective too, because I think Tony did a great job of talking about the definition of it. And when we're coming from the mental health perspective, we're dealing with so many multiple issues. Just on health literacy, we're dealing. I think digital services and digital health has really helped mental health literacy tremendously, because we're dealing with the issue of stigma. A lot of people don't want to know things. They're fearful of even opening the book to talk to somebody about it. And really over the last 20 years, people's openness and access to digital information has really kind of allowed a lot of the stigma that's been historic in mental health addiction starting to start chipping it away. And it's really because of the digital access of information, a little more literacy coming out. It's crossing as things that start to happen in schools that never happened before. Our media, if you look at the media of 20 years ago, we started advertising medication that people can use to start dealing with depression and anxiety. That starts opening things up. So really, we were always, as the Mental Health Association has been around for a long time, our education had been person to person, one to one, trying to get people to come together in meetings. And we have worked always very strongly with libraries and gatekeeper organizations. And we're very limited in what we could do, unless, of course, somebody was very impacted by a mental health crisis in their lives. Then they have to know everything they possibly can. And it was very limited of where they could find it. So I think the health literacy availability for mental health and behavioral health issues has been terrific. That's really helped us start to change some of that access. And I think we've also seen that a lot in COVID. One of the roles that the Mental Health Association had in COVID is we were the statewide, from the state of New Jersey, the behavioral health access line. If you had emotional issues. So we've taken about 150,000 calls. And from the beginning of the whole process, people were looking for information about access. Okay, how do they access information on COVID? So we had many ways that we could share that electronically, different places we could go. We were involved, obviously, in telecommunications to get people crisis counseling immediately. We could send them right there. They didn't have to go anyplace. We could transfer the call. Great stuff. But we also saw a big change in who used to call us in the past and who is calling us now. We saw a greater emphasis of people of different languages calling. Different cultural groups calling that we never had before. we have a cultural, a line where we do translations of different services for translations. And I always look at the budget. We used to spend about $500 a month on it. We wound up spending $7,000 or $8,000 a month because people of different language because they saw, again, we're beginning to be teleeducation, our helpline. So, we see this as a really important value that needs to happen. And I think it's happening in so many different areas right now. Some changes that we see very much is the telehealth for mental health issues. Although it started as clumsily as everything else that we did, but when it was going, it increased people's participation rates in going to therapy sessions. You took away issues of transportation issues, forgetting issues, childcare issues. It actually was very, very positive. If it was video, it was very effective. I think people felt very effective with video. Telephone, it steps down a bit. But we also have the same issue that we talked about. The 20% I think is pretty good. Of the people that are chronically in need of mental health services, we figure at least 20 to 25% had no access. So they were using flip phone. We were getting flip phones to people, but that didn't always work. So again, I think it's that equity issue that we really have to look at if we're, and I see that as a very important role for libraries to be involved in. It's helping us get to that equity level. Because if you can give somebody, one of our magic tools here, and they have the skills to understand and how to use it, and Tony was great examples there with your mom, that fits people who have a chronic illness, have chronic mental health issues, who just can't do some of this stuff. And the technology and the steps, it's not an easy piece to make this thing really work. And so again, I think there's real good community partnerships that I think that we can look towards to develop with libraries as being accessing your traditional role as educators, access to information, and gatekeepers in the community.
Thanks, Bob. One of the things I think about, and I know we worked with you in the past, I always think about the frontline staff in a library, and when people come in and they're in a crisis, and teaching them how they should react and what they should do. And I know that you do a lot of great trainings with that in your organization. And I just want to bring up, I know that teens are in crisis today also in very, very high numbers. And I think that you have some things specifically for teens, don't you?
Well, I think that's really I have to say everything is in crisis right about now. There's a crisis of access to care, and it's not even the telemedicine access to care. If you look at in the behavioral health world, I guess one of the good outcomes of the last 2 years is people are much more aware of their mental health illnesses. They're much more aware of their kids, but their kids have been dramatically impacted by COVID. And it really just picked up what was going on before COVID and enhanced it. This didn't magically happen because of COVID. Things are usually pretty well connected, but it definitely, increased the situations for kids. The problem is we don't have the access of the services. So how you're educating people about the information, but how do you get to getting people to provide the services and get the services? So we're in that kind of mix here where the workforce isn't there to meet the demand that we've now created. So I think there's a lot of things that we're looking for, and it is working again with gatekeeper organizations. Schools are really the number one piece when it comes for teens, and we're involved in launching nationally a project called Teen Mental Health First Aid. We've worked with libraries before for adult mental health first aid to help librarians understand what to do in a crisis, how to deal with that the best they can, and as being non-clinical folks in that profession. And teen mental health first aid is now launching around the state. We're doing a pilot of 10 high schools, and that's going in actually and training an entire class. We go in and train the entire 10th grade in how to help each other, how to help the school. So that everybody in the school all the kids get trained in a certain class. So there's a lot of that kind of training. There's suicide prevention training going on. So we're again trying to access that, and we're doing it virtually. You know we have to pop in and be virtually doing those kinds of services. And I think that helps because it allows this kind of training not to, Michele, we always had trouble getting people to a location, do a training. Now we can pop into everybody's staff meetings and do a training. So I think there's more access to information for the caregivers and the gatekeepers, as well as the individuals. And I think, we have to look at how that can help our abilities to be more effective in our jobs and our communities.
Great. Thank you. Pam, do you have anything you want to add at the end here? What is digital literacy in the context of health literacy and telehealth? And what does health literacy mean in simple terms?
Well, I think that was covered pretty well. And I also love Tony's examples because we see that as well. People don't know how to get into their electronic record. I did want to point out a couple of people I think said in the chat, like not everybody has email. And again, like I work with rural populations, a lot of people don't have email, and you just assume it's kind of like with the smartphone, like when you don't see that all the time. It's surprising to find out how many people don't have that. But I did also want to share just one example, which I think fits this so well, was we did a study several years ago in rural Virginia looking at what are people's knowledge of cancer prevention. And the amount of misinformation out there is so surprising. And the idea that, again, libraries are in every community, the information is in the library, but people aren't somehow getting, they don't even know what questions to ask. And I think particularly around cancer, but probably a lot of chronic illness, there's so much information. I think it feels overwhelming to people. And so I don't know that it, how we even approach that to kind of make it, easier for people to be willing to dive into, because I think it feels very scary. And of course, there's so many great sites out there. And again, with cancer, I think about American Cancer Society has amazing information that's very simply delivered. But how do we get people to even be interested or willing to say, yeah, I think I'll try to find that out, instead of thinking mistakenly, people are either mistaken about their beliefs and are doing the wrong thing, or they say, oh, it just changes all the time, and so I don't do anything, which I think people, it's because they feel overwhelmed. So,
one point that the thing is that I think in the world in which we live, trust is not a big thing. People don't trust information. They don't trust the internet. They don't trust. They find things they want to believe, they don't want to believe. And we're really dealing with that. I don't think we can ever underestimate that, because that really, COVID has been a great example of who's trusting what health information. But I think one of the things that libraries have in the community, I think if you're looking one of the more trusted institutions that are there in a community, is something that's, not a partisan place to be. I think that's an important role that libraries have, because there aren't that many places that have any level of trust anymore, and being that place, because you have to help people sort out once you get get the technology piece in place. What are the trusted sources, and how are that? Because there are just as many people on our wonderful World Wide Web who are trying to sell you something and are going to try to take you in one direction than give you basic straight information. So that's really also a really underlying or overriding question as we move forward in this movement on virtual information.
I mean, I think with librarians by training, if you went through an MLS program, you're able to evaluate health resources, at least. And I know that with media in general, I mean, there's a whole resurgence of like, how do you trust the news right now? And I know that there was like, I used to teach this maybe 5 years ago, where there was the CRAP test. I don't know if you've heard of that test before. And I think that it helps people think about evaluating things related to currency, relevance, authority, accuracy, and its purpose. So by doing that, it helps people rethink about like, well, where did this piece come from? Is this something that I can really trust? And generally, it's difficult to do that when you're thrown with so much information on social media and like just commercials or news. It can be a little overwhelming. And then also, if you're on social media, you're getting things from friends and family members because they're on, say, Facebook with you as well. So it's really one of those things where they need to maybe take a step back and rethink and see what they're sharing something that I can really trust. And 9 times out of 10, a lot of times people will not take the time to do it because they say, oh, I know them, I went to high school with them or something like that, and just move on. So it can be kind of tricky there too.
Yeah, I want to go back to something that Bob said, and then I have a comment I want to read in the chat. It was the issue of trust. And I know when I do some other presentations on disaster preparedness, there was a study. Sorry, I can't quote what the study is now, but it found that librarians were the most trusted people in a town, more so than anyone else, certainly more so than emergency responders, their mayors and councils. And so people felt comfortable coming to librarians. And it was like such a high percentage, like 80%. And it was all ages of people, especially millennials. It's very high above millennials, the trust that they have for librarians. And so I think that that's a great thing we have in our favor in putting these sorts of programs in place. So yeah, and then I think Elizabeth mentioned suggested, I would like to see a push of public libraries to partner with medical libraries. Most medical libraries don't have a lot of patrons from the community, but most do consumer health outreach of some kind, plus have the knowledge. So any comments on that, or?
I can probably add to that, honestly. For medical librarians to do outreach, it has to be explicitly stated within the university's strategic plan and goals. Otherwise, a medical library will focus on its institutional users, and that's pretty unfortunate. And many private institutions just focus within their own community and don't necessarily do a lot of community outreach per se, unless they include something like social work or public health, where they are required to go out as part of their curriculum. And it may involve a librarian, but not as much as, say, the full support of the library. Many public health sciences libraries, like a state university who has a health sciences library, even then, they're still insular in supporting, say, the College of Medicine or the College of Nursing specifically. And it could just be one person supporting a student body of over 1,000 students sometimes. And that's a lot of people that they have to try and like help have a little bit of a footprint on. So in one way, it's kind of lucky that medical libraries do want to partner with public libraries. It's just trying to make sure that there's this mutual collaboration that occurs where everyone understands what can I truly contribute to this project that you'd like to do. And so by starting that conversation early versus saying, oh yeah, let's reach out to the medical library after you've developed a full outreach plan, it's really difficult because I know that public libraries plan basically a year in advance for some projects and activities. They've already probably started planning the next summer reading program, for instance. So it's just as much as you plan, so does the health sciences library plans as well. So just keep that in mind and start planning as far advanced as possible and start initiating those conversations. So it does take a bit of time, but if all parties are interested, I think that there can be some really great partnerships out there that I've seen at least. So I think that opens the door for a lot.
Did you have something? Did you have something to add?
Not to the library piece, but I think that's, again, anytime you can get partnerships that they can get trusted pieces of information out to the public and establish yourselves that way, I think that's a real positive kind of thing. So I'll wait till the next question. I got a couple other things, but you know.
So I'll just finish up with this one. I know in the program that we have going in New Jersey State Library out to the field, there are apps to the big regional medical hospitals or telehealth, but we have no partnerships with any kind of medical or nursing committees or projects. And I know in Delaware, and probably because they're a much smaller state, and I believe that Nick said that there may not be as many medical hospitals as we have in New Jersey. I believe in Delaware, they are actually working and have a partnership with the health field, especially the nurses. But I think that they're on a scale that they probably can do that. And I don't know if that is an option in New Jersey. I know there's some people that do have and can work on those partnerships, but I don't know about for everyone. So I know it's a difficult thing, and it would be optimal if we could have everybody from the medical, the nursing field involved to help us out. Okay, thank you. I just want to make sure, is there any other questions in the chat? I don't think so, but if there is, somebody could raise their hand and see if I missed anything. So I'm going to move on to the next question. Actually, I'm going to skip the second question because I think a lot of you mentioned this already, but I can come around to it again. But I would like to know, how does digital literacy affect public health? And why is it so important for the well-being of individuals?
Well, I'll just kind of jump in on that because I really think that's the modus of people's learning now is digital transformation of information. And I think what we really need to do, and in whatever formats that we have to do that, is then again increasing the capacity of people, especially those that don't have other resources. And we'll talk about, let's say the 20% we'll just use the 20% of the flip phone world. How to use digital services. And I think, one of the things that we did during COVID is we developed a program with another organization called Digital Peer Support. And it was two things. One, to teach people how to use providers also to how to communicate digitally with people. People that are providing support services, people that, we kind of look at it almost as a one-way street here. You also have to learn how to use Zoom and how do you change your engagement with people from a face-to-face situation to a virtual situation. So that's a really important piece, because once we get this door open, I think it's a critical piece for public health, because you're talking about people's mental health, physical health. As Michele talked about, disaster response, little bits and pieces of things that we've been involved with. This is how people are going to need to live in the future, and I think there are a lot of people now, millenniums, I'll use that word, my daughters, they know how to use this stuff. They live and breathe it. You're not teaching anybody anything as long as they have access to the technology. So really, as Pam mentioned, we've got to solve the ability that people have access to the technology, but then you have to make sure people can use that technology. And you're going to be focusing with different populations, from Tony's mom to folks that have chronic illnesses, they can't use it, or they can't function with it. Because I think it's a really important way. I think in COVID, we talked about the phrase isolation. Everybody was isolated, and digital supports helped a lot of people, but a lot of people didn't know how to use it, And one of the things that we pioneered at the Mental Health Association, which I'm very, very proud of, is that
You've muted yourself.
I'm
There you
sorry, I
go.
know, but my dog was barking, so I yelled at the dog. So I apologize for yelling at the dog. But we put all of our services, our support groups, our training virtually instantaneously. And we saw some great opportunities that we attracted a lot more people to our services because they didn't have to come to a place. They could pick it up at their house. So there's all sorts of ways that this is kind of changing a lot of the things that support people that have behavioral health issues. And I'll stay in my niche there, but also other kinds of things. All these 12-step meetings. Think about how many libraries, support 12-step meetings across, AA, NA, all sorts of others. You guys were closed for a long time. They switched to virtual. Some people couldn't use the virtual. They were isolated. So I think there's really interesting opportunities that if we see virtual as being something that doesn't replace the face-to-face contact, and we're not saying we should do that, but it's going to be a growing piece. And it actually can expand people's level of support and education. You just don't have to go to a physical place. So we have to look at creative ways of doing that. And the one piece I just wanted to say is that we created this program, which we're very excited about, and it's called United by Wellness. Okay, and really, in the behavioral health world, we're talking about positive things that help people in recovery from mental health or addiction, or people that are just like you and I, struggling with some low-level anxiety, some depression, who want to learn about this. And we have a wellness center that that's virtual. So instead of having to go to a place, sit with people that you don't know, start that whole process, you can come onto this program. And it allowed us to combine resources from all over the state that we had into one program. So now, instead of running a program, for one or two groups a night, which was considered a lot, we actually have a program that has 80 groups a week, 7 days a week, that operate pretty much 10 hours a day. That's free. So we've changed our ability to educate, engage, and start building another level of community for people. My biggest concern is, who are we leaving out? And I think that's the other issue. That's how we have to figure out how to do that as a society, or we're just going to, continue to splinter as we've unfortunately been doing these last couple of years.
Pam, I have a question for you. I know that, increasing digital technologies to the lower socioeconomic groups, improves health, and those that don't have access to those technologies, are in poor health. And I was wondering if you ever thought of, or if you're contemplating doing some sort of a study that shows, when telehealth is brought to some of these rural libraries, are they making a difference? Are they making a difference in the care of the people in that community?
Yeah, I actually think about this all the time, because the question is kind of like, how do you design the study? And I think, it's hard because when you do a study, you want to focus on a certain population, but a lot of libraries understandably aren't going to be population focused. So I've actually just had a conversation this week with somebody about possibly doing something like this with type 1 diabetes, and looking to see, or you could even do it with type 2 diabetes, but you could look at certain outcomes. You could do the same thing with blood pressure, but you could look at hemoglobin A1C, which is a sort of a long-term metric of how well someone's diabetes is managed. You could do it with, different, cardiac outcomes, but it helps to do it on that population. Because otherwise, really what you're sort of looking at is, maybe how many missed appointments does somebody have? How much have you reduced their distance? But really, for this to be powerful, you need to have those health outcomes. They're just challenging to study at this point because programs are still, kind of emerging, and as they emerge, they're sort of figuring out who they are and what they want to do. I do think, though, within probably 5 years, we'll be able to do some of those studies, particularly as you could do them in multiple, across multiple locations. But I'm very interested in that because, as I'm probably sure everybody knows, like if you can't demonstrate that something works, you're never gonna, get politicians to pay attention, and that means money and, all the resources that you need to get for it. We need to be doing that work. And I'm very hopeful to be able to do it, at some point as these programs continue to emerge.
Yeah, I know that in the pilot program we're doing, we're only counting how many times the actual device gets used
Right.
per month, and that's our success measure right now, but not how much, how do they really help people, and what kind of difference might you see in the community.
Well, and I think the advantage of having like myself or somebody like Bob, be in collaborations with these is that we can, direct how to measure the health outcomes, or we can get the, institutional review board approval to make sure that it's all being done ethically. Like you have then people that can bridge that gap to the health piece and measuring the health outcomes. Because I mean, libraries probably aren't going to know how to do that, which makes sense. It's not their world, but I think this interdisciplinary collaboration is so incredibly important to moving that research forward into the future. And my sort of other reason for wanting to do that is I've realized through, my entire experience with libraries that they are serious scaffolding in our public health system. That is not, the US public health system is just not that strong. And libraries have kind of come in and underpinned so much of that in different communities, and they do it differently depending on where they are. People don't know this. And I think it needs to be elevated just in general to people beyond, those of us that are doing research and beyond the library community, because I'm not sure that most providers have any idea how much care is achieved through a public library in any particular community. And they should know.
I agree. Anyone else to add anything? Somebody said something the other day I thought was just great. And they said that the library is the door. You open the door and all of a sudden there are all these services behind that door that many people don't even know that was there. And I just thought that was a great way of thinking about it. We're the front door. You open it up and we have all these services, available. And I thought that was great. I have another question. And I thought about this after I picked the panel, and I realized that I had sort of two different facets of the healthcare field here. I had Pam and Tony, and they were sort of focused maybe on physical health and illnesses and things like that. And then Bob and his organization was on mental health, focused on mental health. So my question was, are these two very different things? How can they mesh together? Or are we using the same kind of apps or databases for both of these? So where are they different, and how can where can they connect for libraries and librarians to help out and provide, and give the services for both?
Well, I mean, some of that I can address because particularly things like a lot of cancer care and chronic illness management, particularly in nursing, are very focused on psychosocial, which while it isn't necessarily mental health care, it is about connecting people when they need that. And so we're really looking at the whole thing. But in the physical care world, where now we're just talking about telemedicine video visits, not like remote patient monitoring or any of that, which is like a whole other physical care piece. But with telemedicine video visits, there's so much of chronic illness care is what we call kind of education and management. It's educating people. It's figuring out what are their barriers to health promotion and health, and disease prevention. And a lot of that stuff really goes right into the world of psychosocial mental health care. So it is a lot of the same stuff. I think it might just differ who the specific provider is, but a lot of it is this sort of exchange where you're assessing the person's, environment, or you're assessing their voice or their posture or their, pain or whatever through the video exchange, but also then providing that supportive, and educational and therapeutic intervention.
And I think that, what we have to do is provide the link from that education to what we focus on a lot is once you get past the clinical support, and whether it's a physical clinical support or a emotional mental health clinical support, that's a pretty limited intervention in someone's life, and time-wise and whatever. The thing is, how do you maintain yourself in the community? How do you maintain that level of recovery? And again, with its chronic illness, it's going to be long-term, with the diabetes, with the cancer, with cardiac issues, with mental health issues, with substance use. How do you prevent that relapse? Okay, how do you prevent people to maintain the best standard of life they can, quality of life they can, and how do you get them back engaged in the community, because those chronic illnesses move people towards isolation. And I think that's the mixed piece, that we're still in silos, and there's not really, I think, a real, it's like you go do that and you go do that, but how do we do this together? And that's where we're not at yet, because it's really not an integrated system yet. But I think the leadership and the good minds know that we're getting there. And I think, as usual, it's usually the economics that drive it together. And we always have to say the mighty dollar does. But I think those things are working, but I don't think there's a real recognition almost that there are two camps there. And we have to figure out how to make it work. Clinically, I think we do, because that's the money. But then the support thing that's going on in the community, everyone's still doing their own thing. But then the libraries are the center. It's a gatekeeper to get people to those right supports in the community.
And I think, as someone who also personally has chronic illnesses, what my physicians did that was kind of wonderful was actually direct me to like local chapter associations that were focused on the particular diseases that I was contending with, and see about like social discussions to talk about it and help me get through the processes that I needed to get through, so that I can lead a healthier life myself. So it's not just the clinician or maybe one group. You need to like have like a whole village basically to help you out. And it can be difficult if you're like in a remote area or you feel isolated, especially due to like a small global pandemic, for instance, that makes people feel isolated. It's trying then to figure out the best ways to connect with that community, and discovering like different websites that might have like different features, that like chat groups, things like that. And so it kind of helps push things a little bit forward. But for those who don't have the technology to do that, going to the library, who may have the technology available, is really important for them, so that they can get that community input as well of the group that's suffering through any particular disease. And they might have like advice that can be shared then too.
Great point. I'm going to hit the last question now. But before I do, I'm hoping that you're thinking about please filling out an evaluation form at the end of this session. And I know you will be getting links to the session, and there'll be the link to the evaluation form there. And Andrea is always on top of things. She already popped it right into the chat there for you. So the last question I have is, what advice and suggestions do you have for libraries to address the needs of their communities around health literacy and telehealth? I know you talked about a lot of them here, but what other advice would you have in order to get them to address their community needs?
I would just pop out and just say that, play to your strength. Your strength is being a trusted place in the community for information, work in collaboration with local partners that you're already doing. But what do you have to offer that can help bridge this gap? I'll just give one little example. It's not been with the library, but support groups are really important places for people to go. And virtually we have a lot. But the technology could be that a library may want to be a place where they could host a virtual support meeting as well too, for people that don't have the technology to come and be able to attend and be part of that support group, and bring somebody else they know who may be in the same place. Visually, they can be on a computer, it can be on a TV presentation, on a Zoom. We've been doing that with different kinds of programs in different locations at times, but it's been able to reach a different number of people. For example, we've done that at a boarding home where people can't get out. That's an opportunity. Maybe there's opportunities to do those kinds of things in the community to start educating and providing that service to or people that don't have the technology. Just a thought.
I could just add, and I talked about this a little bit in my talk, but I think it's so important to also know your community. I mean, and librarians, I think, do. People that work in the library are usually members of the community. They know their community, particularly, some of those more vulnerable populations, they may be more aware of them than sort of an average citizen, and they kind of know where the issues are. And I think that's a really good place to start. Is to sort of think about that, think where, and as Bob said, combining your strengths, what you have going on with the needs of the community. Because I do, I do see, and I want to just acknowledge that I see that libraries are asked to do so much. And so, right, I mean, you see that all the time. They're like, oh, the library can do, whatever the need is. And so I love the idea of, playing to your strengths and integrating that in there as well. And then or if you have established community relationships with certain populations or certain groups, then to move forward from there. Because I mean, I feel like everything that can be done is a little, really helps get the community healthier and helps get them more connected.
Playing to strengths, I think, is the best thing that you can do. Sort of like when, say, for instance, there was tax season, you kind of help people with maybe not doing their taxes, but helping them find the information they need so that they can complete their taxes on their own. Also, say when the Affordable Care Act became available, you were helping people sign up for health insurance then. So, there were all those digital skills that they need to help do that, like creating an email account. You can easily do that and not feel that you're intruding upon their own privacy. Helping them understand how to download an app, how to browse the internet, how to change camera settings. Those are things that I take for granted because I'm exposed to the technology so much, but then I have to realize, again, someone might not have that exposure at all. When I taught my first class at a senior center, I brought in all of these laptops and computers to help teach them how to use a computer, not realizing that, oh yeah, they have arthritis in their hands and there's no way that they can double click. What can I do to go around this so that they can actually get to the internet and do what they need to do to find and do the information they need? So I had to rethink the end user, basically, where are they coming from? What are their needs? What's missing that I can maybe provide that way too? And I know that for a lot of librarians, you're skilled at evaluating information, and you can help address health misinformation or medical misinformation quite easily. So you can help people with online searching, navigating online web pages, reviewing for online credibility, and trying to help them identify other resources other than what they might find on a general online search, for instance. So those are things that I think librarians can definitely do. There's also, I'm going to share a link from the National Library of Medicine. They have partnered with the All of Us program. It's a research program, but they have a digital health literacy training program. And it's something that even librarians can download. I believe there's PowerPoints that you can use. And it's scripted too. So it's all laid out for you if you want to try and help with some of the digital literacy skills necessary to help with health literacy as well. So that's something that I wanted to at least share with all of you too.
Thank you. That's wonderful. I know in the past we've had NNLM come in our region, which was not Region 1 before, but I forget what the region was, but you're our regional representative now. But I know that they've come several times, and they've also taught us how to use like all your databases that you have the health information, and that's very helpful for them to get to know, where to go, the best resources to look up and get accurate information. So thank you for that. And I'm wondering at this time if any of you have any final thoughts before we start to close out the program today. Because your talk was wonderful, Pam, and all the discussion was wonderful. We learned a lot. I also want to tell anyone that's on listening today, if you would like further information about the pilot program that we're running here on telehealth, you can contact me. I can give you more information on that. So if there is no other final comments, I want to say that this brings our 4-day summit on digital literacy to a close. And it's really been a wonderful event, and it's covered a myriad of topics featuring the experts in the field. And I want to give a huge thank you to our speakers today and also over the last 4 days. And for our attendees here and for the days prior, we hope that you have a deeper understanding of the current state of digital literacy in local libraries, and that you were able to bring a lot of information home with you to get started if you don't. And I know this is only the beginning of our conversation. So we still have a few minutes left. And at this time, I really would like to invite the Lifelong Learning team back on for a few minutes. And I'd like to hear some final thoughts from them on the last 4 days. And a reminder again to please complete the evaluation at the end of this. So I have Mimi Lee, Sharon Rollins, and Andrea Lewandowski have all done these programs over the last 4 days. Mimi in ESL and adult education, Sharon youth services, and Andrea in workforce development. And so I'm just wondering if you guys have any final thoughts that you would like to say over, either your day or over the course of the whole summit.
I can go first. Well, today was another excellent day. I think all the panelists and the speaker, Pam, Bob, and Tony, the excellent discussions that really comes from the academic point of view and practical point of view. I mean, it was just a wonderful workshop that all of us actually had a little bit of heart. So I really enjoyed it. Looking at the 4-day this week, it was the first time we've done this before, in terms of the teamwork and the digital literacy and whatnot. I think it was well done. I am very proud of my team. I really appreciate Andrea, Sharon, and Michele for collaborating and putting efforts into this. And I think we are really in a better place looking at what we are dealing with, the conditions that we have now coming after 2 years, or we are still in the midst of it, but the once in a century event, and I think we are better prepared to face what's upcoming. I hope that we are. So I leave my comments at that. Do I pick Sharon? You want to go next?
Sure, Mimi. Yeah, I have to say that, every presentation was wonderful. I've learned so much from all the panelists and all the keynote speakers. I guess, from the youth services point of view, we're always sort of slightly a little different from everyone else, but I am certainly seeing their common threads across every single session. I mean, there's all the questions of, equity, of whether that's, everyone having access to devices and knowing how to use them. The fact that broadband, is a problem. The fact that languages, there's lots of different languages spoken. But I'm very heartened by the fact that everyone's talking about, collaborations and partnerships and reaching out with other organizations, and like the librarians themselves and the library attendees had some great suggestions. So I'm so heartened to know that, there's such an interest in this, and that everybody's really coming up with ways that, that this can really help. And I can just see this conversation continuing. I would just say that we hopefully, we'll have either a follow-up or do this again, because I'm sure that the next time we do this, there's going to be a lot of solutions mentioned that we may not even have been talking about at this point. So thank you all for sharing your knowledge, and just for our department working together, because I think this is an extraordinary opportunity for us to do something we never done before. And I'll go to you, Andrea.
Yeah, and I want to also highlight, they're familiar names, and I apologize that I don't know if you're familiar from one other webinar or all four, but if you did attend all four and you're still here, an extra round of applause for you, and please call yourself out in the chat, because thank you so much for supporting this and the entire forum. And I think that is one of my major takeaways, even though I have so many, is that sometimes we come at certain topics from our own perspective, and we don't realize until we pull it all together under that big umbrella topic how interconnected library services are between populations and topics and population groups. And that you might, when you're registering for something, think that's not for me, but then when you take the time to listen, you realize that is exactly what I needed and the perspective that I needed. So I'm ditto to everything that Mimi and Sharon and Michele have said so far about this being such a professionally rewarding experience and working with you guys, and also just I am so appreciative for the eye-opening experience of hearing directly from the library staff and everyone who attended and provided comments, and from the expertise of the speakers, and realizing how many solutions will just come out of us all being together and working together. And so I'm excited to explore some of those solutions, excited to work with all of you when we have our debrief on Monday, and I'm excited for what we are going to do next. So thank you.
So I have one final thought, and I think that over the 4 days, the things that we learned about digital equity goes into a larger idea of when we take care of the most vulnerable people in our community, when we help them not only with digital literacy, but in all the other things that we do, it brings the whole community up. It makes for a more resilient community, a community that's able to get through crises better together. And this is only one part of it. This is only one part of it, but everything that the library does to help the most vulnerable in our community that needs help brings the entire community up, makes it sustainable, makes it more resilient. And that's really what we want these days too. This is a piece of it. There are many other pieces of it that I work with, and I'm just glad to add another sort of a staple, into the whole group of services that we offer. So with that, thank you again, everybody. Thank you, Lifelong Learning Team, for joining me today, and being behind the curtain there and helping me in case there was any mess ups with Zoom. Tony and Bob, thank you so much for being here. Pam may have already jumped off and gotten to her next keynote speech, so she's highly in demand. Thanks again, everyone, and I think we're going to sign off now. Take care. Thanks for joining us, and look for more to come. I'm sure there'll be more programs and projects, especially around digital equity, coming from the State Library. Thanks so much, and bye.